Hi, it's Randal and welcome to another video. Anxious Minds is now beginning to offer dedicated veteran family support. We'll be conducting an interview with the people involved in an upcoming video to discover and explore what this new service offers. But today we'll be taking an introductory look at one of the most common mental health challenges for veterans, post-traumatic stress disorder. This is classed as an anxiety disorder and is caused by very stressful, frightening and/or distressing events. So let's have a brief overview of the two main types of PTSD and complex PTSD. The symptoms of PTSD are very taxing both personally and for family members. Reliving the traumatic events which cause the problems through flashbacks and in nightmares leads to an unpredictable, unsure state of being, which leads to irritability in dealing with people and situations, a sense of isolation, not being understood or able to fully communicate these feelings, and also feelings of guilt. Sleeping problems such as insomnia are very common, which in turn triggers problems with concentration and general focus. These are severe symptoms which persist, and you can see how they have a massive detrimental impact on regular day-to-day living. The causes of PTSD are rooted in any circumstance or situation where a person experiences a singular or series of traumatic events. These can include witnessing the horrors that can occur in military service, a serious traffic accident, having been through a violent personal attack such as a mugging, robbery, assault, whether one-off or sustained assaults over a period of time, or rape and sexual assaults. As a result of serious medical problems which can be ongoing, or a singular event such as a particularly difficult childbirth. And one of the most serious aspects of PTSD is that it may not appear immediately after the traumatic event, but manifest at some point in the future from days to years later. Up to 1 in 3 people who've suffered from a traumatic event can be affected by PTSD, but research determining the factors in neurological functions which cause the development of PTSD in some people, but not others, still in the very nascent stages and only beginning to be analysed and understood. Now, there's also complex PTSD, a more serious form of the same condition, which appears more from exposure to repeated traumas, abuse, repeated forms of violence, including sexual and neglect. Complex PTSD features many symptoms of the regular diagnosis, and again may not manifest until sometime after the trigger events. The severity of the condition becomes greater the earlier in life the trauma has occurred, which can mean typical childhood development is very negatively impacted. We've all experienced what can be classified as traumatic events, but many people are able to improve and largely recover within a reasonable time frame, generally several weeks or so. However, if you are still experiencing difficulties a month or more following the experience, or if the symptoms persist in a way that's detrimentally impacting your daily life, then it's time to seek help from your GP or a similar service. The good news is this condition can be treated even if it is severe or years after the initial trauma, though the specific treatments you will be offered will depend on these factors. The following options are some of the recommendations you can expect. Watchful waiting, basically monitoring the condition to see if it fluctuates positively or negatively without treatment. Antidepressants, to try to bring the symptoms back to a manageable level so you're able to begin living your life and functioning again. Psychological therapies. Two best examples of these would be CBT, cognitive behavioural therapy, essentially a talking therapy based on structuring solutions specifically on who you are and what you're facing, or EMDR, eye movement desensitisation and reprocessing, a therapy which can be very successful by helping you reassess and reprogram behaviours on a very foundational level. Ask your GP or check online to see what support services are available in your particular area. There's social care and supplemental support available from agencies such as Anxious Minds. We hope this video has helped introduce you to this topic or broaden your general understanding of the condition you're facing and the help that's out there. Once again, thank you for watching. Keep tuning in Anxious Minds as the videos start to rack up over the weeks. Remember that it's okay not to be okay. I've been Randal. Take care of yourselves and each other.